Population and COVID-19. The population of the world is constantly changing, and population estimates have been made about population growth. The Population and COVID-19 research paper provides a comprehensive overview of this topic. This article discusses issues such as population projections, effects of population on COVID-19 cases, and what factors may affect the future population of the world. Population and COVID-19 cases. The number of cases increases with the population, so it is essential to be aware and prepared for the threats that come along with a burgeoning human race. It will only get worse before it gets better. The problems we experience today are nothing compared to what lies ahead in the future as populations continue to grow at an exponential rate. The population of the United States is currently over 300 million, which has led to 19 out of 100 cases being co-occurring. The U.S.'s current population exceeds 300 million people, and with this many Americans comes 1 in 5 who have a psychiatric disorder that also presents alongside another mental illness diagnosis, such as depression or anxiety disorders, for example. Population and COVID-19. India population and COVID-19. Coronavirus has swept through the country of India, and that's just in one day. The virus can be deadly to those who are not immunized against it, leading some experts to believe that there could potentially be a worldwide pandemic on their hands with this latest discovery. India's response to a breakout of its own version, HCV-EMC, seems measured and less panicky than other countries with outbreaks that have dealt with much more severe consequences. The Indian government is working closely with WHO officials who are providing guidance on how best to contain this virus before it can overtake large populations, like was seen in Africa last year when 240 people died from just one species known as Zaire Ebola virus, EBO. While warning signs began appearing months ago for an impending epidemic, many believe it may be caused by climate change altering habitats where these animals live along animal migratory paths which humans cross at various times. China population and COVID-19. The coronavirus is a virus that has re-emerged in China, causing people to become ill with pneumonia and the flu. The coronavirus was believed to be eradicated years ago, but it resurfaced after being found in some Chinese patients. The virus causes people's lungs or stomach lining to thicken, which can result in acute respiratory syndrome, SARS, or sepsis-induced organ dysfunction due to its destructive effects on their immune system. U.S. population and COVID-19. The coronavirus is a virus that has been spreading across the United States. The CDC says it's affecting about 18% of people in this country, and they have no idea what causes it or how to stop its spread. A coronavirus in the United States causes severe illness, including fever and pneumonia. This type of infection usually comes from contact with infected animals like bats or camels. It's also possible to come into close contact with someone who already has it, such as if you were caring for them at home while they are sick without any protection around your mouth and nose. You might not know right away because symptoms often don't show up until 4 days after exposure, when most people have left their jobs due to being too ill. UK population and COVID-19. The coronavirus is causing issues in the United Kingdom. Cases of this virus have been increasing since November, and it's expected to continue rising as colder weather approaches. The UK has seen a significant increase in coronavirus cases over recent months, according to NHS Health Protection Scotland, HPS. The HPS states that there were 22 confirmed human infections of novel respiratory tract infection associated with SARS-like coronaviruses reported from hospitals across England during this period. 18 hospital staff or visitors and 4 patients who had recently visited another healthcare facility or stayed at home care residence before visiting the hospital for other reasons such as surgical treatment for cancer diagnosis/treatment management services. KSA population and COVID-19. A coronavirus is a virus that infects the respiratory and gastrointestinal tracts, typically causing mild to severe illness. Certain strains can cause more severe diseases such as SARS or MERS in humans, while others are not harmful at all. The Kingdom of Saudi Arabia has had new cases on an average of 1 per year since 2000, with over 40% being fatal without treatment. In the Kingdom of Saudi Arabia, a coronavirus has been detected among citizens. Experts are unsure how or when it arrived in this country, but they have urged people to be vigilant about their health and avoid contact with infected individuals if possible.